This conference will now be recorded.
Hello, Arbaz. When are you starting?
Yes, I'm starting immediately.
Yeah.
Yes, I'm starting immediately.
Okay, one second. I have a doubt. If I switch off my speaker, if I disconnect from the audio, will the recording not have the audio? Anything like that?
I don't think there should be a problem.
Okay.
But try to,
This conference will now be recorded.
Yeah, I will switch it off in the last, just for 10 to 15 minutes. I have to. Okay. Sure, start.
Okay. Yes. So guys, have you revised the cardiac cycle? I hope Sadat has taken that session very well, and I hope you have revised the cardiac cycle very well. We'll just have a glimpse of the cardiac cycle. What is the plan of today's session is, see, there are certain things in cardiovascular medicine that is related to physiology. And if there are certain alteration in those, there is certain disease. Like for example, JVP, jugular venous pressure, there are certain waves in jugular venous pressure. Yes, all those waves, if that some of the wave is accentuated or some of the wave is depressed, that will show some abnormality. So when you will be able to pick that abnormality, when you are able to relate that wave with the event in the cardiac cycle which is taking place. So not only the wave, not only the JVP, ventricular pressure changes, atrial pressure changes, the valvular events, the heart sounds, and at the end we'll also be relating the pressure volume curves, the ECG, and also the cardiac potential with cardiac cycle. Basically today's session is, which events of the cardiac cycle will these events correspond to? Like for example, X wave in the JVP, it will correspond to ventricular ejection period. So like that, it is very difficult to imagine at that time in the examination or near the patient when that event is taking place. You have to go to the theory in your mind and all. So if we just have a single paper of all those things, whenever you are having any question regarding that, you'll have this paper in front of your eyes. So take a paper. Take a paper and we'll have this. So what is the plan of today's session? How we'll be going through? Is my voice audible?
Yes, Arbaz.
Yes, I'm audible, right? Okay. So guys, yes. Now I'll be asking questions also. We'll end this session in 30 minutes. It's not a long session. Yes. So guys, cardiac cycle. This is the cardiac cycle. So these are the events in the cardiac cycle. These are the atrial events. These are the ventricular events. Can somebody let me know in the chat box what is the normal duration of the cardiac cycle in seconds? Can someone tell me, please? Can someone tell me? Yes, what is the normal duration of the cardiac cycle? 0.8 seconds. So yes, this is the time, guys. Here is the time. This is the time. So 0.8 seconds. Atrial event will take place for 0.8 seconds. Ventricular event will take place for 0.8 seconds. So let us start. So let us write what events what. So atrial systole for 0.1 second only. Rest all is the atrial diastole. You all know this. Yes, Sadat told you this. Yes. So 7 times right atrial diastole. 1, 2, 3, 4, 5, 6, and 7. 1, 2, 3, 4, 5, 6, and 7. Yes. 0.8 seconds over 0.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8. Atrial events for 0.8 seconds over. Same like ventricular events. When will ventricular systole start, guys? Ventricular systole start, and for how much duration it is? We all know that it is for 0.3 seconds only. So 3 times we have to write Vs. When we will start Vs? After atrial systole, blood will come inside the ventricle, then our ventricle will push the blood outside. So after atrial systole, should our ventricular systole start? This is the ventricular systole, guys. This is the ventricular systole. This is the ventricular systole. Yes, rest all right. Vd. How much? How many seconds? 0.5 seconds. Yes, we all know this. 0.5 seconds. So out of 0.8 seconds, 0.3 seconds, 0.1, 0.2, 0.3 is ventricular systole, actually, where the pumping of blood is taking place. Yes, rest all is ventricular diastole. So this, now what we are going to relate it to, here write down the phase, guys, the phase. We'll name the phase over here. This is the phase. Okay, so I am drawing this thing. Okay, this much I'll draw. Okay, next, after phase, we will see the valvular events taking place, guys. Yes, here we will write the valvular events. Here we will write the phonocardiac events, means the heart sounds. Here we'll write the heart sounds. Next, what we'll write? Next, we'll be writing some more things, JVP and all, that we'll write in a sequence. First, let us just understand this part. What is this part? This part we'll understand. What are the events taking place over here? We will understand just for 2-3 minutes. Then we will be able to relate that very easily. You will be only able to relate. There is no need for me to tell. You will only be able to tell. Yes. So first, from where we will start? We will start from this point. I will draw diagram. Just a second. I think I'll take this book also, because yes. So yes. Is it visible? Yes. Is it visible over here? Yes, I think it is visible. So here I'll be drawing the events. Yes, yes. So here what is happening? This is my heart. This is the superior vena cava. This is the inferior vena cava opening into the right atrium. This is the right ventricle. This is the pulmonary trunk. This is the pulmonary trunk. Here you will have your semilunar valves. Yes, this is the right side of the heart. Similarly, there will be left side of the heart over here. So we are only seeing one side of the heart. Same events will be taking place in the other side of the heart as well. So what is first we are starting with? First we are just observe this diagram, observe these events. Just imagine, try to imagine. So first what will happen? Blood should enter from superior vena cava and inferior vena cava into the right atrium. So right atrium should be full. Where it is entering? It is entering in this phase. So I'm drawing arrows like this so that it is entering atria. This is atrium, right? Atrial events. So blood is entering into the atria. Draw like this. Has it entered the atria? After it has entered the atria, it should enter the ventricle. Then it should enter the ventricle. So from atria, next it will enter into the ventricle. It will enter into the ventricle. As from superior vena cava, inferior vena cava, it is entering into the atrium. After the atrium is full, blood should enter into the ventricle. Next, it will enter from atria into ventricle. Yes, yes. Now, we all know that the entry of blood from atria to ventricle will take place in 3 phases. What is that? The first rapid ejection, slow ejection, and last rapid ejection. Last rapid ejection is nothing but due to contraction of the atria. So first 2 events is occurring just passively because of opening of this valve due to drop of pressure in the ventricle. The blood from atria is entering into the ventricle. So this is passive entering. But in atrial systole, it will enter due to contraction. So this is the atrial systole. Yes, I hope this is clear. So here what will happen? Here what happened? Blood came from superior vena cava, inferior vena cava into the atrium, and from this part it entered passively. From this part it entered passively. How much blood will enter in this? 30%. How much blood will enter into this? 30%. How much blood will enter from his? 30%. Yes, 30, 30, and 30. So let us name the phases over here also. This is known as what? Atrial systole. We all know. This is known as atrial systole, and the phase name of the phase of cardiac cycle is Last rapid ejection. Last rapid ejection. You all know this. Is it making sense, or I'm telling it to myself only? Can anyone tell in the chat box? Yes, type yes or no.
Yes, Arbaz.
Only hush. Others also tell. Yes. Revise. I will revise. Don't worry. Till now, did you understand? What did I tell? Yes, I will revise. This I will revise. When we will relate, no, then you will understand what is this. Yes. So let us name this event now. This event where blood was first entering from atria to ventricle. That was a passive event. So this is known as your first rapid filling. First rapid filling. First filling, you can say. First filling. Yes. Now what is this phase? Slow filling. Slow filling. Slow filling. So the filling of the ventricle, three phases are there. This is one phase, this is one phase, this is one phase. The last phase is due to active pumping of the blood from systole, atria, due to atrial systole. Atrial systole. That is known as last rapid filling. Yes. First is due to passive. So first rapid filling. Yes, this is. Now, just concentrate to what I say. Concentrate to my words. When will my blood from atria will enter into ventricle? When this valve will open. When this valve will open. AV valve, atrioventricular valve will open. When will this valve open, guys? When will this valve open? When the pressure over here is less than the pressure over here. Yes. So for this valve to open, the pressure over here should rapidly drop. Rapid drop of pressure. So whenever there is a rapid drop of pressure, the one of the valve will open. That valve is AV valve, guys. AV open, right? Open. So valvular events we are writing over here. Okay, these are the valvular events. So when it will open, whenever there is rapid drop. So once it opens, once the AV valve opens, blood will enter. So now the blood is entering. So when this valve will open, whenever there is rapid drop of pressure. So this phase of the cardiac cycle is where rapid drop of pressure is taking place. And this phase of the cardiac cycle is the phase where rapid increase in pressure is taking place. So there are two phases in the cardiac cycle, where in one phase rapid increase in pressure will take place, in other phase rapid drop of pressure will take place. So both these events I will tell the definition of this. You will only tell which phase it corresponds to. So the phase where rapid increase in pressure takes place is a phase of the ventricular systole, where all the valves are closed, but there is rapid increase in pressure. Only tone of the muscle is increasing, but there is no contraction of the muscles, and there is no ejection of the blood. So which phase I'm talking about? Sadat told you this. Yes.
Isovolumetric contraction.
Isovolumetric contraction. So phase number 2 here. Write down isovolumetric contraction. You're so clever, guys. Yes. Isovolumetric contraction. So isovolumetric, the volume is not changing, but pressure is rapidly increasing. What will happen due to this rapid increase in pressure? We will see over here. Here you concentrate first. Isovolumetric relaxation means rapid decrease in pressure. The volume is not changing, but there is rapid decrease in pressure. Due to rapid decrease in pressure, which valve will open? Yes, this valve will open. AV valve. AV valve, has it opened due to rapid decrease in pressure? Yes, it has opened. We will relate. Just try to have some understanding over here. We'll be able to relate. You'll be very nicely able to relate. Don't get tensed. Yes. Now what I would like to say, this event is missing. This event has no significance. It is just known as protodiastole. No much significance. Nothing much is taking place over here. Yes, it is not for 0.1 second as we are mentioning over here. It is less than 0.1 second. So this is not a very significant thing. Okay, not a very significant thing. Now let us see this with another perspective. Now another perspective we will see. With what perspective we will see? See here. Atria are full. Here the atria are full. Imagine this diagram in your mind. Okay, I'll draw this diagram again. For you. So this is the diagram. Yes, this is the ventricle over here. Yes. So due to entry of blood from the superior and inferior vena cava, atria are full. So which phase are atria full? Here the atria is full. So at the end of isovolumetric relaxation, my atria is full. So when my atria is full, they have to give the blood to ventricle. So which valve should open? Our AV valve should open. Is it opening? Who is opening that? Isovolumetric relaxation. Why isovolumetric relaxation is opening my valve? Because my isovolumetric relaxation is rapidly decreasing the pressure. So it is opening. So my atria is getting filled, my ventricle are relaxing. So because of rapid decrease in pressure, my AV valves are opening, and then my blood from atria is coming down into the ventricles. Guys, in 3 phases, guys. What is the first phase? Is known as the first rapid filling. What is the second phase? It is known as the slow filling. What is the third phase? It is known as the last rapid filling due to the atrial systole, guys. So how much blood? Here 30%, here 30%, here 30% of the blood is entering from atria to ventricle. Over. Atria se blood has come to ventricle. Now let us concentrate on our ventricle. Yes, this is my atria, this is the tricuspid valve, this is the ventricle, this is my pulmonary trunk. Only right side we are talking, left side also similar thing will be there. Now what I will draw over here is, guys, over here what I'll draw is this. Now my ventricle is full, my atria has given all the blood. We have seen these 3 phases, AV valve open, these 3 phases. Because of these, ventricle are now full, the ventricles are full. Now here this is the amount of volume at the end of ventricular diastole which my atria has given to ventricle. My atria has given to ventricle some volume of blood, right guys? So that amount of blood is this amount of blood which is there at the end of ventricular diastole or just before the ventricular systole. This amount of blood which is present in the ventricle just before contraction of the ventricle is known as end diastolic volume, guys. This is the end diastolic volume. So the red part is my EDV, end diastolic volume. Yes. Now what will happen? My ventricles are now full. Atria has given their blood to ventricle. Now what will happen? This ventricle has to give the blood to respective organs like the aorta, to the body or to the lungs. So my ventricle should contract. So they are contracting. This is nothing but the contraction of the ventricle. Yes, this systole is contraction of the ventricle. What will systole do? Systole will eject some of the end diastolic volume out. Some of the end diastolic volume out as stroke volume. Is it clear? My ventricular systole, yes, at the end of diastole, just before systole, my ventricle are full. My atria has given the blood to ventricle. Yes, my ventricles are full now. It is full. It has to contract and give the blood out to the body. Yes, it has to give the blood out to the body. So they have to contract. Yes, the amount of blood in the ventricle just before contraction is the end diastolic volume, which I have represented over here in this red part, end diastolic volume. Out of this end diastolic volume, let us suppose 70 ml is there. 70 ml is there, end diastolic volume. Some exact number is there, I don't remember now. Yes, you have to remember because you are in physiology, right? You have to remember. So some amount of blood is there. Out of this, some blood will be pushed out and some blood will be remaining at the end of systole. Yes, some blood out of this end diastolic volume has been pushed out. Yes, and some blood will be remaining at the end of systole. This will be a small amount of blood. This blood which is remaining at the end of our ventricular systole is known as end systolic volume. From this, can you write the formula to calculate the end systolic volume? Write the formula. Write the formula. With that, I'll understand. Are you understanding the concept or not? Write the formula.
EDV minus SV.
Yes.
Schrodinger.
From this EDV, some part is pushed out. So remaining will be ESV. So ESV is nothing but EDV minus SV. Yes. So this was my ventricle filled with blood. Yes. Some part of the blood is now being pushed out at stroke volume. Yes. And diastolic volume minus stroke volume will be the amount of blood left after my systole, which is end systolic volume. So my end systolic volume ka what is significance? If my end systolic volume is more, that means my stroke volume is less. That means my ventricle are not pushing the blood out. So whatever blood was there at the end of the diastole, just before the systole, almost all of the blood should be pushed out as stroke volume. But if some part is not being pushed out, like the stroke volume is less, then our end systolic volume will be more. What does end systolic volume more means? That means all the amount of blood is not going out, some part is remaining. That means my ventricles are not contracting properly, guys. There is some problem in my ventricles. Yes, I think it is clear. So let us see some valvular events that are taking place. Valvular events. Then this diagram is over. Then you see how you'll be able to relate to the other things. Yes, just wait for 2-3 more minutes. Just wait for 2-3 more minutes. Yes. So let us see. Let us see from starting. This was my atria. From superior and inferior vena cava, blood came inside my atria. So here the blood is coming inside the atria. Which phase of the cardiac cycle is my blood coming from? In protodiastole and isovolumetric relaxation phase, my blood is coming into the atria. So it has come into the atria. Now at the end of isovolumetric relaxation, my atria are full with blood. Now due to isovolumetric relaxation is rapid reduction in blood, rapid reduction in pressure, rapid reduction in pressure is there. So due to rapid reduction in pressure, these valves will open. These valves are opening. Due to opening of these valves, AV valves, blood will enter from atria to ventricle. Yes, now my blood will enter from atria to ventricle. Now my ventricles are full. Yes, so there will be 3 phases. Yes, you all know this. So my atrioventricular valve will have opened in 3 phases. Due to 3 phases, my ventricle are now full. This is full ventricle. This is known as end-diastolic volume. My end-diastolic volume is there. Now in 3 phases, my systole is taking place. Now this will contract. This ventricle will contract and blood will be pumped out. Yes. So first there will be rapid increase in pressure. Why there will be rapid increase in pressure? These valves which were open, I have to close that valves so that my blood does not regurgitate. So for closing this valve, for opening this valve, there should be rapid decrease in pressure. For closing this valve, there should be rapid increase in pressure, so that rapid increase in pressure and my valves close. So here which valve is closing, guys? At the end of isovolumetric contraction, rapid increase in pressure, which valve is closing? AV close. Here AV had opened, here AV closed. Now what will happen after AV closed? Due to rapid increase in pressure, AV closed. Now same, due to rapid increase in pressure, these valves will open. Which valves? Semilunar valves will open. So after this, my semilunar valves are opening. Semilunar open. Have my semilunar valves open? Yes. So after my semilunar valve have opened, this is in the systolic period. Yes. So my ventricles will contract and push the blood out. Yes. These valves are open. These valves have opened. Yes, these valves have opened. So this is in the systolic period. Like after isovolumetric contraction, these valves open, these valves closed. Yes, these valves closed, these valves open. Then due to contraction of the ventricle, my blood is pumped out in 2 phases. What are these 2 phases? Phase number 1, phase number 2. This phase number 1 is known as rapid ejection. Ejection of blood is taking place. That's why ejection we are telling. This due to rapid increase in pressure, there is rapid ejection. Then this is slow ejection. Then my systole is over. At the end of systole, some blood is remaining. That is end systolic volume. Someone please put Samira, please put the feedback form on the WhatsApp groups. They are forgetting to put. Yes. So
Okay.
this is the slow ejection. My entire cardiac cycle is completed. Yes, but one valve which is open, I have to close that valve. Which valve? At the end of. So I will draw one more time because it should be incorporated in your brain like anything. This is one of the tough topic to imagine. Cardiac cycle seems to be easy, but to correlate all these with these, it's one of the tough. This is simplifying it to a certain extent. So my ventricles were full. Due to isovolumetric contraction. My volume was not decreasing, but the pressure was decreasing. So there was rapid increase in pressure. These valves closed. So I have closed these valves. Then then due to same rapid increase in pressure, these valves open, blood came out. So semilunar valves open.
Arbaz, you
Arbaz,
are
your
not
audio.
audible. Arbaz, uh,
Arbaz.
here.
This blood which was there in the trunk, it
Arbaz,
will.
Hello, Arbaz.
Arbaz, for a few seconds you were not audible.
Okay, I was not audible. From what time I was not audible?
Just a few seconds before.
Few seconds. Okay, I'll tell once again, guys. I'll tell once again over here. So this was our heart. Yes, this is our ventricle. Yes, atria, from atria blood entered into the ventricle. That we have seen, all these steps we have seen. Now ventricle में blood है, वो blood को बाहर pump करना कौन कर रहे? Ventricular systole. कितने events है? 3 events. There are 3 events. So first event is where rapid increase in pressure is taking place. So due to rapid increase in pressure, there are 2 valvular events taking place. One is due to rapid increase in pressure, this valve will close. My tricuspid valve will close. Yes, AV valve has now closed. Now what will happen? This valve will open. This valve will open, and in these two phases, my blood will be pumped out. My blood is being pumped out. Yes, my blood is being pumped out. And after the ventricular systole is over, my ventricles will relax. So at the end of the systolic period, my ventricle will relax. Yes, they are relaxing now. Ventricular diastole is starting. So when diastole is starting, the blood which is present in the major great vessels will now put pressure on these valve, the semilunar valve. So the semilunar valve will now close. When will semilunar valve will close? After the ventricular systole, when there is decrease in pressure. When there is decrease in pressure in the ventricle, the blood present in the trunk, the pulmonary trunk and the aorta is coming back and pushing the valves down. That is closing the valves. So which event is now closing the valve? Which event is now closing the valve? Which event is now closing the valve? Yes, here after the systole, when there is decrease in pressure. So what is decreasing the pressure? The diastole. So which valve is closing? Semilunar close. Semilunar close. So Sadat told you, Sadat started his session with telling that heart sounds will be audible due to closure of the valves or due to opening of the valves. Can you tell me in the chat box?
Closure. They're
Closure of
replying
the
closure.
valve. So closure of my AV valve should produce which sound? My S1. Closure of my closure of my semilunar valve will produce which sound? S2. S1, S2 heart sounds. Can you now relate? Between my S1 and S2, which activity is taking place? Which activity is taking place? My systole is taking place. So whenever you are now putting a stethoscope in your ears, put the diaphragm of the stethoscope on areas A, P, T, M, aortic, pulmonary, tricuspid and mitral. Put over there. You will hear lub over here. Lub, L-U-B-B. Here you will hear dub, dub. So what you will, just hearing this sound is not sufficient. What inference are you getting? So you have to think that, okay, my lub has started. That means my systole has started. Ejection has started. So ejection of the blood has started. My dub has started. That means the ejection is over. So from dub to again lub, that is the diastolic period of the heart, where the filling of the chambers is taking place. Filling of the chambers and filling of the ventricle. So between my two heart sounds, S1 and S2, what is occurring? My systole of the heart is occurring. My systole of the heart is occurring. So lub, dub, lub, dub. So between lub and dub, my blood is ejected out. So that is the ejection period of the heart, guys. So there will be sometimes splitting of these heart sounds. Sometimes these heart sounds will be louder. Sometimes these heart sounds will be softer. So beyond this, that is just beyond the scope of discussion at this level. When you come to second year, listen, I'm telling the source, write down, somewhere you write down, listen, heart sounds lectures by Dr. Najib. Dr. Najib. Heart sounds lecture by Dr. Najib. Have you written down? Yes. How many lectures are there? 5 lectures are there. On S1 sound, 2 lectures are there. On S2 sound, 4 lectures are there. You have to listen all these 5 to 6 lectures on heart sounds. When you are listening those lectures, keep these in front. Keep this in front. See how easy that becomes. Yes. So my heart, how many events have I related to my cardiac cycle? The valvular events I have related, the phonocardiac events I have related. We will now relate the JVP, atrial pressure changes, ventricular pressure changes, ventricular volume changes. We will relate. But before that, once again, I will just tell you this again. Again, I will tell. Again, I will tell. So I am repeating this. I think this is the 4th time I'm repeating. Just listen, guys, because it is very important. Yes. Okay, just a second. Yes, I've adjusted this. Yes, guys. So for blood to be pumped, what is the function of the heart? To pump the blood out. So this is the pumping activity which is taking place. To pump the blood out, there should be some blood inside the heart to pump it out. Yes, this blood. From where this blood is coming? From the atria it is coming. In how many phases? 1 phase, 2 phase, 3 phase. So blood has come into the ventricle from the atria so that it can pump it out. So this has come. So where will atria get the blood from to give it to ventricle? From superior and inferior vena cava it will give. So it will get the blood. So my superior vena cava, inferior vena cava are giving the blood to atria, which are again giving the blood to the ventricles in 3 phases. Then at the end of the ventricular diastole, just before the starting of systole, there is some blood remaining over here, which is known as the end-diastolic volume. Out of this end-diastolic volume, due to the contraction of my heart, some blood is being pumped out as stroke volume. And at the end of ventricular systole, there is, just concentrate on what I say. At the end of the ventricular systole, there is some blood which is remaining, which is known as end-systolic volume. Yes. Now what will happen? Now the ventricle will relax. Now the ventricle will relax. Let us see the valvular events now. Valvular events again. So let us see the phases. So atrial systole event where 30% of the blood was pushed out, that is known as last rapid filling. So other 2 phases were told, other 2 filling phases were known as first filling and slow filling. I hope these filling phases are clear. Yes, it is clear. Now let us see the ventricular phases. So all this was diastole, 0.5 second. 0.3 second is the ventricular systole. Yes. So what is happening? The valvular events. My blood is full in my ventricle. Full in my ventricle. For my ventricle to pump blood out to my body, my AV valve should close. My AV valve should close. Let me show this diagram also. So my blood is full in the ventricle. My AV valve should now close so that this can be pushed just here out. So for this AV valve to close, there should be rapid increase in pressure, which phase it is corresponding to my isovolumetric contraction. Due to rapid increase in pressure in the middle of this phase only, in the middle of my isovolumetric contraction only, this AV valve is closing. My AV valve is closing. So at the end of isovolumetric contraction, due to increase in pressure, which valve will open? These valves will open. These valves will open. Which valve has opened? Semilunar valve has opened. Yes, my semilunar valve has opened. So blood will now be pumped out. Now blood will now be pumped out. So this has been pumped out. Yes, systole. At the end of pumping, some blood is remaining. So some blood is remaining at the end of pumping. Some blood is remaining over there. Yes, yes. So what will happen now? Now my ventricle will relax. So ventricular diastole is starting. Ventricular diastole is starting. Ventricle is relaxing, relaxing, and relaxing. So because of this relaxing of the ventricle, what will happen? The blood which was there in this column of blood will push my valves. Now this will close the valve, semilunar valve close, which is forming the S2 heart sound. Then what will happen? Due to more dilation of the ventricle, more decrease in pressure, this atrioventricular valve which was closed, which will now open. This will now open. When it will open? At the end of isovolumetric relaxation, where rapid decrease in pressure was taking place. Is it clear till now? Type yes. This should come in front of your eyes.
Yes, sir. Was the replying yes?
So is it not clear? I am getting very few replies. 2-3 replies I got. Type, everyone type yes. How many members are there? I have 66 members. Yes, 66 replies I want. Yes.
Yes, yes.
So I will
They are
now.
replying.
I think for some members this is overwhelming, because you will not understand this unless and until you have read the cardiac cycle. Yes. So I think I was clear till now. If for even one member I am able to solve this, I feel great. Just a second. Just a second. Yes.
S is saying no. What's the issue is?
Okay. Can I continue?
What didn't you understand? Yeah, yeah.
What did she understand? She will understand now. Don't worry. She will understand. I will go slow. Okay. So what is now, what we will relate it to now? S3 and S4 heart sound will be there. S3 and S4. What is S3 heart sound and S4 heart sound? Are they normally audible in the stethoscope? They are not usually audible in the stethoscope. How will they be audible? They will be audible in one instrument known as phonocardiogram. Phonocardiogram. Do you all know this? Yes. So what is causing this S3 and S4 heart sound? Our first rapid filling from atria to ventricle blood was coming due to rapid decrease in pressure. Our AV valve has opened and atria is giving the blood to ventricle due to rapid filling of this blood. This is known as this will cause S3 heart sound, S3 heart sound due to rapid filling. So which phase of the cardiac cycle is my S3 corresponding? You should tell first rapid filling phase of ventricular diastole. You should tell this in Viva. If you
Yeah, I would
don't
just like to
remember,
add,
if you
Arbaz.
don't feel like
Yeah,
it,
S3 sound is heard because of the turbulence of the blood. Okay, because of the rapid filling, the blood fills up very fastly, so the blood causes that sound. Okay. Yeah, you can continue, Arbaz.
yes, yes. This is not due to any valvular event, as Sadak told. This is not due to any valvular event. It is due to rapid entry of blood, turbulence of the blood. Blood is coming and hitting the ventricle, So that is why here only sound. Why not here sound? Sound is not over here because there is rapid decrease in pressure. So valve has opened. So atria mein full blood. So that full blood means full pressure. So from full pressure, it will come and hit my ventricle. So that is causing an S3 sound, which will not usually be audible in my stethoscope. When will it be audible? When my ventricle have become stiff. So what causes my ventricle to become stiff? There are hypertrophic cardiomyopathy. All are there. Ventricular stiffening, hypertension, and all those are there. So we need not discuss it right now. So you can relate all this with some diseases. In medicine, you will appreciate this diagram. I don't know in physiology will you be able to appreciate or not, but this is going to solve your problem in medicine. Yes. So atrial systole. Yes. Now S3 is over. S4 why S4 is occurring? That is due to turbulence of blood in the atria. So due to atrial systole, my atria is contracting. So blood will be pushed in my ventricle due to contraction of the blood, contraction of the atria. That is my S4. So S4 will correspond over here. Hope this is clear. S4 will correspond over here. S3 is here. My S4 is here. I hope this is clear. Phases we have seen, valvular events we have seen, heart sounds we have seen. You all know this actually, but how to relate we have seen. Now let us relate to atrial pressure changes or your JVP. What this guy is telling, JVP is my JVP is nothing but atrial pressure changes. Yes, guys, your JVP is nothing but your atrial pressure changes only. How? Let me show you over here. Let me show you.
Arbaz, Aksa wants you to repeat S4 once.
Okay, I'll repeat, Aksa. Don't worry, I'll repeat. So first you listen over here. What is JVP? So this is my right atrium. This is my superior vena cava. This is my inferior vena cava. Yes, this is my tricuspid valve. This is my ventricle over here. This is the pulmonary trunk. This is the AV valve. Yes. So listen. इधर दिमाग दौड़ाने का है जरा. Internal jugular vein and the subclavian vein. Someone is calling me repeatedly. That's why my mic is getting. Yes. Someone was calling me. That's why my sorry guys. Yes, I will repeat once again. इधर थोड़ा दिमाग लड़ाने का है. क्या है बोले तो this is my atria, this is my ventricle, this is the superior vena cava, this is the inferior vena cava. My superior vena cava is being formed from right and left brachiocephalic trunk. So these are my right and left brachiocephalic trunk. My brachiocephalic trunk is formed by the subclavian vein and the and the internal jugular vein. Can you see, guys? My internal jugular vein is in direct line with my right atrium. Is it in direct line with my right atrium? Type yes or no. Yes or no. Yes or no. Yes, it is in direct line with my right atrium. So whatever pressure changes take place in my jugular vein will be the pressure changes taking place in my ventricle, in my atria, right atria. So jugular venous pressure or jugular venous pulse is nothing but it is showing the activity or the condition of your right atrium, guys. Is it clear? Is it clear? Yes. Yes. Type yes. Yes.
Yes,
So
Abbas.
how am I measuring my JVP? So there is one clinical method to measure JVP. There is one interventional method to measure JVP. What is my interventional method? So I have to put a probe in my internal jugular vein. This is the neck of the person. This is the neck of the person. This is the head of the person. This is the body of the person. So internal jugular vein will be here. So I have to puncture the internal jugular vein. Here I have to put a probe which will measure the pressure. So here if I measure the pressure, that is the interventional method. So what is the other method I can do? In clinical postings they will ask you, and in physiology practicals also they'll ask you. What I will do, I will ask the person to lie down like this. How is he lying down? So that his neck will make an angle of 45 degrees with the body. So his neck is making an angle of 45 degrees with the body. These are his legs, these are his hand. This is the bed, this is the bed. So he's lying on the bed, this is the pillow, this is the pillow. So he should make an angle of 45 degrees. The neck should make an angle of 45 degrees with the body. Here is the heart, here is the heart. So how will you measure? You have to keep a scale like this. Okay, I will show you like this. Just a second, I will take this paper and show. So if this is the person, this is his neck, so this is the body, here is the upper limbs, here is the lower limbs, this is the bed, this is the bed. So keep a scale like this over here. From where you will keep the scale? On the sternal notch. Where are you keeping? Angle of Louis, sternal notch. You will keep a scale over here. Have you kept a scale? Yes. Keep a horizontal scale where you can see the pulsations on the internal jugular vein. You will see some pulsations on the internal jugular vein. There you keep this horizontal scale. Where my horizontal scale is intersecting my vertical scale, that is my reading. Suppose that is 2. Suppose that is 2. So my JVP is 2 plus 5, 7 centimeters of water. 7 centimeters of water. Why this 5? Why did I add this 5? Because from the heart till the body wall there is some space. So we are keeping the scale on the body wall. So from the heart till the body wall there is some space. That space we are not telling. So we are adding a constant called as 5. So constant equal to 5. So 2. Anything, the scale reading which you are getting, add 5 to that. That will be your JVP clinically calculated. Interventional calculation you can do by putting a probe inside this internal jugular vein. Is it clear how JVP is measured?
Yes, Abbas. We are
Yes.
clear with it.
Yes, it is clear. So is it getting overwhelming, guys? Is it getting overwhelming? No. Can I continue? Yes.
Yes, Abbas, you can continue.
ना इजी है ये, क्या है, कुछ भी नहीं है इसमें, इजी है सब. चलो JVP को इससे रिलेट करेंगे कार्डियक इवेंट से. We will relate. So JVP waves. What is JVP? Just keep in mind JVP is pressure. Where? In the atrium. We are keeping the probe in the internal jugular vein, but for our understanding, imagine that probe is in atrium now. So I will tell you, in the atrium the probe is there. So whenever there is increase in pressure in the atrium, my JVP graph will go up. Whenever there is decrease in the pressure in the atrium, my JVP graph will go down. So in the cardiac cycle, when is the pressure increasing in the atrium and when it is decreasing in the atrium? Let us see. So atrial systole, pressure will increase or pressure will decrease in the atrium? Atrial systole, increase or decrease? Right, chat box? Increase. So I will draw increase. So due to atrial systole, my pressure has increased. Yes. Now atria is undergoing diastole. Atria is undergoing diastole. So pressure should decrease. Pressure should decrease. Pressure should decrease. Yes, it has decreased. But simultaneously, my ventricle is undergoing systole. My ventricle is undergoing systole. When they will contract, which valve is closing? My tricuspid valve is closing. So tricuspid valve will bulge out. So I will draw over here. So this is my heart. This is my heart. This is the tricuspid valve. This is the ventricle. So I'm keeping a probe over here. Due to contraction of this atria, pressure has increased. So this pressure has increased. Now atria will undergo relaxation. The pressure will decrease. Pressure will decrease like this. Yes, it is decreasing. Now after atrial systole, my ventricle will undergo contraction. So this will close this valve and try to bulge the valve up. Bulge the valve up. Due to bulging of the valve up, this probe will, the pressure on this probe will increase. Yes. So that will cause an upstroke again, guys. Upstroke again. So pressure has increased due to bulging of my AV valve inside the atrium. Upstroke again. Yes. Now what will happen? The blood is ejected in outside. The blood is now ejected outside. So the pressure on this valve is now decreasing. So it will come down. So my pressure in the probe will also come down, guys. It will come down like this. Yes, it will come down. So during the ejection period, rapid ejection, slow ejection. During the ejection period, my pressure in the probe of the right atrium is also coming down. Is it coming down? Yes, it has come down. Now again, it will increase. Why it will increase? Why the atrial pressure is increasing? Because see here, the blood is coming in the atrium. Yes, that's why my pressure will again increase. Has it increased due to entry of the blood? Yes, it has increased. Now what will happen? Now the blood from atria is going in the ventricle. Again, the pressure in the atria will decrease. So here atria se ventricle kane aa raha blood. So again my pressure is decreasing, guys. Again my pressure is decreasing. Then the graph will continue from here like this. So can you see there are 3 upstrokes and 2 downstrokes. First downstroke is called as X wave. Second downstroke is known as Y wave. First upstroke is known as A wave. Second upstroke is known as C wave. Third upstroke is known as V wave. A, C, V upstrokes. X, Y downstrokes. What is this? JVP. I will once just listen to my words now. Concentrate to my speech. What I am telling, you will understand what JVP is now. JVP is nothing but the pressure in the atrium. You're putting a probe in the atrium and recording the pressure changes in the atrium. Now related to the cardiac cycle. During atrial systole, due to the systole of the atria, my pressure is increasing. That's why my graph is going up. That is my A wave. So when my atria is undergoing diastole, my pressure is decreasing in the atria. So that's why my graph is coming down. But as the ventricular systole is starting, my ventricular systole isovolumetric contraction, my tricuspid valve will close, and will, due to the pressure, it will bulge in the atria. It will it will bulge in the atria. It will bulge in the atria. That's why
after A wave.
Yes, my
bulge. After A wave there will be X descent, and after C wave there will be X dash descent.
Yes, you can name that X dash and X also. X also you can name like this. But this wave is not significant at all. So we are not naming this over here. Okay, no significance. So yes, so C wave. What is C wave? C wave due to the pressure increase in the due to bulging of my tricuspid valve in the atrium. Yes, bulging of the tricuspid valve in the atrium, the pressure is increased. That is corresponding to my isovolumetric contraction. See over here. See, isovolumetric contraction. Yes, due to now pushing of the blood out of the ventricle, my bulged tricuspid valve is coming down. That is causing decrease in the pressure. That is my X wave or X dash wave, as you can see. Yes, this is the X wave or X dash wave that you can see. Now it has come down. Now due to again filling of blood in the atria, the probe will get pressed, and pressure will increase like this. This is known as my V wave, guys. V wave. Yes. Now again, this will be the Y descent because my atria is going to send the blood to ventricle. This diagram you remember, guys. I am asking some rapid fire question now. Answer in the chat box. Takes half a second break. Take half a second break. Just see this and revise. Other events in 5 minutes I will tell. Other ventricular pressure, atrial pressure, ventricular pressure, ventricular volume, ECG or cardiogram, and pressure volume loop. 5 minutes का है, कुछ भी नहीं है वो. This is the main thing that you have to understand. All my pathologies will be based on this only. So just see it for half a second. I'll take half a second break. I'll ask you some questions, then we'll proceed to that, then we'll end the session. See, from the entry of the blood to the atria till
Arbaz, you're not audible. Arbaz, you're not audible.
yes, yes. People will keep on calling. If I cut one time means they should wait till I call. Yes, for half a second time I'm giving. See, what are the events? See, just see. Imagine the brain. Imagine that this diagram. Imagine this heart car diagram. See the events. Relate these events over here. 1 minute time you take. No hurry. We'll do it slowly because this is very important. So the people who have missed this session, no, they have missed how to relate. So anytime you're reading cardiology now in medicine, see how easy it becomes. So can I start now? Can I start? Yes.
Yes,
Keep
Arbaz.
this in front. I'll ask question. Type in the chat box. Just one, 2-3 questions I'll ask. Not that. What I'll ask, how these are related to this. See this and answer. Yes. Due to rapid ejection of blood out of my ventricle, which wave is my JVP seen? Rapid ejection of blood out of the ventricle during ventricular systole, which wave is seen?
They're replying X wave, X dash.
Yes, very good guys, very good. Without thinking you are answering. Yes, very good from this. Yes. Now, rapid decrease in pressure. In my entire cardiac cycle, rapid decrease in pressure in the ventricle is taking place. What is that? Phase, guys? What is that phase?
IVR.
Isovolumetric relaxation. Yes, isovolumetric relaxation. Yes, that is very good. So, due to rapid decrease in pressure, one of my valve will open. As there is no pressure, one of my valve will open so that blood from atria should come into the ventricle. Yes, guys. I am not even completing my question. You are answering. Very good, guys. My S4. So Aisha wanted me to repeat S4. Someone wanted me to repeat S4. What is S4 actually, guys? This is the turbulence of the blood in the ventricle. The musculature sound hai. Contraction of my atrium, muscle ka sound hai. This is the muscular sound. Contraction of my ventricle of contraction of my atrium is causing sound. S4 sound. Normally S4 will not be there. In some diseases where my atria has to contract very forcefully, there S4 will come. So S4 is corresponding to my atrial systole. Yes. So what are the causes of my S4 sound? When my atria has to contract very forcefully. When my atria will have to contract very forcefully, whenever there is stenosis of the tricuspid valve, guys, or the mitral valve. whenever there is stenosis, my chota hai hole, chota hai hole. Stenosis means there is stenosis means kya bolte hain, chota ho gaya, opening, aperture is becoming small. This is my atria, this is my ventricle. This stenosis means my aperture is becoming small. Okay, hole is becoming small. So push the blood over here. My atria has to contract more. That will cause S4. So atrial stenosis is one. Atrial stenosis is one of the causes. And pulmonary hypertension and my pulmonary stenosis also will cause S4 sound. Yes, yes. Is it clear? Yes. Now I will ask 2 more questions, then we will proceed to 5 minutes. That session entire will be over. What should I ask? What should I ask? Yes, I will ask. My V wave is due to increase in pressure in the atrium due to, my V wave is corresponding to increase in pressure. Why that increase in pressure is there?
They're applying blood filling venous system.
Blood filling, see, blood filling. Between my first heart sound, that is due to AV closure, and my second heart sound due to semilunar closure, what event of the cardiac cycle is taking place?
They're applying ejection phase. Systole.
Guys. Excellent, ejection phase, systole and systolic volume.
Arbaz, you're not audible. Uh, Arbaz?
Hello, Arbaz.
I guess even he won't be able to hear. Arbaz? Arbaz, you were not audible.
I'm not.
Hello?
Yes. Am I audible now?
Yeah.
Yeah.
After
So
the last
atrial
question which you
system.
asked, you were not audible.
Okay, this is so I'm writing another time so that we can here place is not there at the back the place is not there, so we'll write one more time. We'll skip the valvular events, phases and sounds events, then other events we'll see. JVP also will skip, as we have seen, we'll see the other events. So this is atrial systole. Now 7 times you have to write atrial diastole. 1 2 3 4 5 6 and 7. 5 6 and 7. Yes. Now, after atrial systole, ventricular systole will start. This is ventricular systole. Yes, ventricular systole has started. Yes, other all fill 5 times ventricular diastole. 5 times fill ventricular diastole. This is my cardiac cycle, guys. Cardiac cycle. These are my atrial events. These are my ventricular events. Yes. So because of systole, some blood is going to pushed out. That is the end diastolic volume. Then some blood will be remaining. That is the end systolic volume. Yes. So this is the isovolumetric contraction where rapid increase in pressure is there. Because of that, which valve will open? My semilunar valve will open. In the middle of my isovolumetric contraction due to increase in pressure, which valve will close? My tricuspid valve will close, or the AV valve will close. Yes, at the end of the systole, as there is rapid decrease in pressure over here in the isovolumetric relaxation, which valve will open? My tricuspid valve will open. Valves have to open. Yes, at the end of this ventricular systole, my ventricle is undergoing diastole, that is decrease in pressure in the ventricle. So blood column in the aorta and the pulmonary tract will push the valves down. Which valve will close? Semilunar will close. So tricuspid will cause the S1 heart sound. This closing will cause the S2 heart sound. Between my S1 and S2, my ventricular ejection phase is taking place, and between my two tricuspid event or the AV event, both my semilunar event are taking place. Yes, I know this. Yes. Then what we will see? We will see the ventricular pressure, ventricular volume changes. Let us see. Nothing is there. What ventricular volume changes will be? So first let us see ventricular pressure changes. Where is ventricular pressure increasing? In the systole it will increase. So in the systole you increase the pressure. Rest again you decrease the pressure. This is nothing but ventricular volume change, ventricular pressure change. Yes. Now ventricular volume change. Ventricular volume changes. When will my ventricular volume decrease? When my blood will be pumped out as stroke volume. When it is being pumped out in the systole. So ये उल्टा है इसका ग्राफ. Similar. So you have to put an upstroke over here because the filling is taking place over here. So little upstroke you have to put over here. So this is the upstroke that you have to put. Yes. So these are the pressure changes. Pressure changes means here it is contracting. That's why pressure is increasing. Here also, as some blood is coming, some pressure will increase. Some upstroke you draw over here. So these are the ventricular pressure changes. Ventricular changes related to the cardiac cycle. So this upstroke and downstroke is related to which phase of the cardiac cycle? I think my ventricular systole. Yes. Rapid ejection, slow ejection, and this isovolumetric contraction. Yes. So my rapid increase in pressure should take place in the isovolumetric contraction. So my peak of the graph should correspond to isovolumetric contraction. Peak of the graph should correspond to isovolumetric contraction. Yes, I think this is clear. Then ventricular volume over, ventricular pressure over. Another thing what is remaining is ECG, nothing. ECG means I will have my P wave. P wave is corresponding to what? My atrial event. So P wave is over here. P wave, atrial event. Then due to my ventricular event, ventricular systole, my QRS complex will be there. QRS, major ventricular depolarization. Septal depolarization, major ventricular depolarization, basal ventricular depolarization. So this is my ventricular systolic event. This is taking place in the ECG. Yes. Then my relaxation of the ventricle will take place, and there will be T wave. T wave. Complete relaxation will correspond to my this phase of the cardiac cycle. This phase just before the atrial systole. What is the phase? What is this phase? Can anyone write down what is this phase? Write down in the chat box.
The replying slow filling.
So these are the filling phase. Can you see these are the filling phase? Here blood has come from above, so here it will go down. It is the first rapid filling, slow filling, last rapid filling. Last rapid filling phase is nothing but T wave. Slow filling is nothing but T wave. Isovolumetric contraction, rapid ejection, slow ejection is nothing but QRS complex. Over. Everything over. Yes. Now cardiac potential also you can relate like this only. So whenever my ventricular activity is taking place, that means my ventricular depolarization is taking place. So ventricular depolarization show over here. Yes. Now this ST segment, QT segment will correspond to my this plateau phase, and repolarization means it will come down. This is repolarization. This is phase 4, 0, 1, 2, 3. I think this is 0. Okay, so whatever the phases are, I don't remember the numbers. So this is the event that is taking place. Have you been able to correlate it? So if someone asks you what is the plateau event corresponding with the ECG, it is corresponding to the QT segment. QT segment, yes. And what is it corresponding in the cardiac cycle? It is corresponding to the diastolic phase, guys. Yes. Diastolic phase. Yes. Is it clear, guys? I think it is clear. So everything is done. Last thing which is remaining is pressure volume loop. Then everything is over. What is pressure volume loop? What is pressure volume loop? Pressure volume loop is nothing but in x-axis we are denoting pressure. Sorry, this is y-axis. Y-axis we are denoting pressure. On x-axis we are denoting volume. So if volume is increasing, that means my graph should go here. If volume is decreasing, that means my graph should go here. So I needed that. Okay, I'll use this book. Just a second. Yes, so that I can correlate like this. Yes. So what I'm trying to show, this is the pressure, this is the volume. So rapid increase in pressure, guys. Rapid increase in pressure. Where it is taking place? Which phase? Rapid increase in pressure. Rapid increase in pressure. IVC. Yes, ventricular systole only. Which phase? IVC. Phase of the cardiac cycle you should tell. Phase of the IVC. In IVC, guys, the volume is more or less. Is my end diastolic volume is more volume or less volume? It is more volume. So more volume, you should rapid increase in pressure. So more volume, rapid increase in pressure. This is the pressure. This is the volume. Yes. So now what will happen? After isovolumetric contraction, ejection will take place. Rapid ejection, slow ejection. During ejection also my ventricle is contracting. That's why there is increase in pressure. But my volume is decreasing as my blood is being pumped out of ventricle. Yes, this is my rapid ejection, this is my slow ejection. So at the end of my ventricular systole, this is the end systolic volume, this is the end systolic volume. This is the end systolic volume. This is the end diastolic volume. End diastolic volume is greater than end systolic volume. So we have presented over here. So this phase is my ventricular systole. This corresponding to isovolumetric contraction, rapid ejection, slow ejection. Yes, yes. So next what will happen? Ventricular diastole is taking place. So protodiastole I told nothing important. So concentrate on isovolumetric relaxation. There will be rapid decrease in pressure. So rapid decrease in pressure, rapid decrease in pressure. So this is diastolic phase, isovolumetric relaxation, rapid decrease in pressure. Yes. Then what will happen? Then filling is taking place, right? Filling is taking place. So volume will increase. So three phases it will be there. So this is the first rapid filling. This is the slow filling. This is the last rapid filling. This is my pressure volume loop, guys. Pressure volume loop. And the area of my pressure volume loop is nothing but the cardiac output, guys. The cardiac output. Yes, yes. So there are some abnormalities in this. I think that is beyond the scope of the discussion of this lecture. Yes, so that will become overwhelming. This is all I wanted to say for how to correlate. Did you like the session? Was I able to tell? Was this something, something helpful, or you already knew it? Yes.
Yeah, they're replying very nice, very helpful,
Yes.
really good.
So this is also through this lecture I wanted to show you is that in one page how can correlate. So I have drawn this 2-3 pages, right? This is one page concept. See one page how I have drawn all these phases I have written over here. The events, the valvular events, the heart sound events, the JVP events, the ventricular pressure events, ventricular volume events, EVCG events, and PV events. So whenever some